Today we are going to discuss about the bone remodeling process. The first process is mentioned here. The first process is the activation of the osteoclast. After that, the resorption process, then the reversal process, then number 4, osteogenesis, and number 5, the mineralization, and again then it go to the number 6, that is the resting phase. So the first phase, that is the activation of the osteoclast, is activated by different factors. It mainly depends upon the osteoblast, because the osteoblast have a receptor. This is a rank ligand. The rank ligand interact with a rank present on the surface of osteoclast, precursor osteoclast, and the osteoblast. And how the osteoblast is activated: different sort of hormone, parathyroid hormone, thyroid hormone, glucocorticoids, interleukin 11, and some other histamine, and many other factors, steroid drugs. Okay, all these activate the osteoblast. Once the osteoblast activate, it synthesis rank ligand and express on the surface, and this rank ligand now form interaction with the progenitor or precursor osteoclast. Many precursor osteoclasts, they interact like this. Okay, they fuse and they form mature osteoclast. Then the osteoclast release hydrochloric acid. They start to damage the bone. So this process is activation of osteoclast, and the damaging process is bone resorption process. After this, the debris of the damaged bone is engulfed by macrophages. So this process is a reversal process, the third process. After that, the osteoblast is activated and it acts on the damaged bone surface and try to form new blood cells. Finally, they form a new lining of blood cell. Bone cell. So this process, which is carried out by the osteoblast, is osteogenesis. Osteogenesis means the formation of new bone with the help of osteoblast. Once the osteoblast form the lining of a new bone cells, the osteoclast help in the mineralization process. We will discuss later that how osteoclast activate the mineralization process. With the help of calcium and deposition of calcium, phosphate, and vitamin. So all this help in the mineralization process. So the fifth step, that is the mineralization, that is carried out by the osteocyte activity. So after the formation of complete bone, there is calcified or mineralized bone. The bone undergoes the process of resting. It rests for 20 months or more than that. So as we discuss here, that first the certain factors which activate the osteoblast, then activation of precursor osteoclast, then osteoclast, mature osteoclast, then it shows the osteoclastic activity, then macrophage, then activation of the osteoblast. This form new bones, lining, a new bone lining. Then osteocyte help in the mineralization of the bone. Then this bone undergo the process of resting. So as we discuss here certain factors which activating them. So we have certain other factors which inhibit the Ranklin pathway. There is one of is estrogen and osteoprotogerin. They inhibit the Ranklin pathway, so it inhibit the osteoclastic activity. So another presentation is that, for example, one person is using excessive glucocorticoid or steroid drug, so it's excess activation of the osteoblast to express more surface ligands. That is the rank L. More interaction with rank, more activity of the osteoclastic activity increases, and more bone resorption, and it leads to osteoporosis. Okay, if the bone formation is less and bone resorption is more, it leads to the weakening of bone, more damage of bone, and this condition is osteoporosis. So all those factors, that is interleukins and glucocorticoids and certain other drugs which which increase the expression of Ranklin on the osteoblast, and in this way it activates the osteoclastic activity and bone resorption increase, and it leads to the osteoporosis. So nature made our these two activities, that's osteoblastic activity and osteoclastic activity, in a normal range, so our bone keep normal and healthy. Thank you.